And my privilege to introduce Dr. Roshan Jain today. Dr. Roshan Jain is a UK qualified consultant, psychiatrist, and a de addiction specialist with over 25 years of clinical, academic, and public mental health experience in India and the UK. A former professor of psychiatry, he is currently based at Apollo Hospitals, Bangalore. He is deeply committed to destigmatizing mental health and empowering individuals through education, compassionate care, and self awareness. Through his talks, workshops, TV, radio appearances, and over 100 published articles, Dr. Jain continues to promote open conversations around emotional well being, addiction recovery, and holistic healing. He believes that people have the innate ability to heal when met with understanding, respect, and warmth. I invite Dr. Jain to share his insights on mindfulness today. Over to you, Doctor.
Thank you for the introduction, Ganesh, and thank you, Manjari, for coordinating the whole talk. And good evening, everybody, to all those attending. And you have done well to take time to understand the most important aspects of our body, our mind, more than the hardware as a brain. The mind itself is equally important. And the talk is to raise an awareness of an ever increasing problem of mindlessness.
नाव बदलणार आहे इकडे
I think it will be good idea to. Can Manjari just switch everybody?
Could you please mute people for now? Manjari, thank you.
Yes, yeah, I'm doing that.
You can mute everybody.
Yes.
Thank you. So we've called the talk Mind Over Noise, essentially to look at mindfulness as to how we need to be more aware of our mind over all the external and internal noises that we are experiencing. And I think the rise in the external noise, as we all know, from the environment, from the traffic, from the people, is exponentially rising. But the noise inside our heads is also rising proportionally, and perhaps more so. While we are aware of the noise outside, we are not so aware of the noises inside, because we are consumed by everything else that we do, and that becomes a problem. It becomes a problem because when we are not aware of what we are thinking, what we are doing, then we are not aware of how we behave, how we react, and how it affects our relationship with ourselves, importantly, but with other people, but with the community, with the nature, with the country. So that awareness is the key. And when you're mindful, then you are more aware, then you're more responsible. And why I put a title as that mindfulness is no longer optional, it has become necessary. And that's what we're going to talk about. And hopefully you'll bear with me. We have about 40 minutes, and I might go on longer, but I'll try to speed up if I'm taking too long. We'll have a lot of time to discuss, which I think might be more interesting aspect where you don't have to be very passive. Ganesh is going to take some of the notes and coordinate the questions, but we will take as many questions as possible because Q&A is more interesting aspect. Right. Okay. So this is what we're going to talk about, the age of mindlessness, and then we'll try to understand what is mindfulness in the Eastern traditions, what are the facets of it, how it is used in modern therapy. Our wisdom, Eastern wisdom, as you know, is thousands of years old. And sometimes I make a joke that the Western psychology is under 200 years old. So we knew it all for much, much longer. And we had the wisdom, but we never properly learned it. Not all of us. But now we have the reach, we have the information, and we'll have some quotes to reflect on, which I think is very important. It leaves us thinking, and we'll have some conclusion, call to action, and Q&A at the end. So are we in an age of mindlessness? Uh, we are in a hyper connected, very deeply distracted world. Uh, I think our concentration, our attention is constantly under siege. Our concentration is fractured. Our focus is completely fragmented, and our mind is scattered with endless sea of information, endless tabs and timelines. We skim through the headlines without actually reading the story. We scroll through life without actually pausing to actually live it. I sometimes make a joke that our mind and body is no longer in sync. Where your body is, your mind is never there. They're separated. They're almost divorced. You're physically present. For example, some of you might be physically present here, but mentally you might be somewhere else. That is become a big problem. And we have become stranger to stillness, to silence, to focus. So for example, when you're talking to somebody, we are not able to concentrate or focus because we are somewhere else. And when we are somewhere else, we want to be here. When you're in the clinic, you want to be in a cinema. And when you're in a cinema, you want to be at home. And that becomes a problem. So we need to be somewhere at some point. And what we're going to do is that we're going to talk about the mindlessness, mindfulness, and see how we can reclaim it, and what are the things that we already know that we need to do in order to get it back. Oops. Okay. So in the age of mindlessness, this is what is happening. Why are we so distracted? We were distracted in the past, but we are more so. Our attention span, as I was telling Ganesh earlier, has dropped from 12 seconds. When we were young, it used to be called as people can concentrate for 20 minutes, if you remember, Ganesh. After that, people are lost. But here we're talking about 12 seconds in 2000. It has dropped to 8 seconds. Remember, the attention span of a goldfish is about 9 seconds. So we are worse than that. And this is one of the very popular Microsoft research. We are checking our phone about 96 times per day. I think that's an underestimation. If many of you will check your phone on the screen time, it will tell you how many times you've checked in a day. Some people are checking it 300-400 times. They're picking up the phone every few seconds, every few minutes. In global web index study, there's a 70% of people admit to mindlessly scrolling on social media to escape. What? To escape stress, to escape anxiety and so on. But they end up feeling more anxious than they did before. Multitasking has always been popularized to say we need to do more than one thing at a time and you are highly skilled. I think it's quite the opposite. It reduces multitasking should be a no-no. We should be doing one thing at a time properly. And multitasking means you're doing multiple things at a time, and that is actually reducing productivity by 40% and increases cognitive errors. So when you're on a tab, looking at a phone, writing something, the phone is ringing, there's sound, and so on. You're trying to do multiple things. You're doing neither properly. So this is what is happening. This is what our life is become. Our lifestyle is become like the man on the couch, multiple tabs on the screen, and we are almost becoming like human with monkey mind. There's a lot of studies from Americans show that they are spending about 60 hours on the screen per week, that includes small, medium, and large screen like television, computers, smartphones, and so on. 8 hours, and some studies have suggested 12 to 14 hours. 54% of teens say they spend too much time on their mobile phones. 41% say they overdo it. They accept it, and these are the kind of people that we are seeing in clinic every day. We are actually on the screen far longer than we are actually asleep. So that's more than 8 hours, which is terrible thing. And as I said, we are becoming humans with monkey mind. So it's all the Buddhist concept. The mind is so fickle and restless, like a monkey who's jumping from one branch to another without actually knowing why they're jumping. So what is the impact of digital overload on our mind? And there's huge. People might know the Forbes study suggested that we are bombarded with 3,000 plus digital ads on an average per day. Did anybody know that? That's 3,000 plus. Okay. An average human mind wanders 47% of the time. This is a very interesting study, and very big study actually, where they called and asked or messaged people to say, okay, what are you doing now? Where is your mind? And how are you feeling today? Thousands and thousands of people were asked. And the data revealed that 47 people said they didn't know what they were doing. They're completely wandering all over. Okay, how do I move this? 1 second. So the information overload results in chronic stress and anxiety, poor sleep, emotional numbing and emotional detachment. And consequently, it impacts our relationships, it reduces emotional awareness, it increases impulsivity and irritability. Let me just see how can I move the screen down. That's better. Okay. So somebody said very nicely that we are drowning in information while we are starving for wisdom. That's what is happening to the modern generation. In fact, Sadhguru said it very nicely as well, that the modern generation has got information but not the experience. And therefore, they are full of opinion without actually having a practical understanding of something. So information with experience is what is required. But our information overload is so much that we have no time to experience it. So the future depends on where we place our attention today. And that's the key to a focused, healthy mind. And without a focused mind, we are going to have all sorts of mental health problems and crises. WHO has already said that mental disorders are projected to be the leading cause of global disease by 2030. It was already on number 3, then it came to number 2 by 2020, and is now going to number 1. And workplace burnout is now officially recognized by WHO as occupational phenomena. And I'll share some more data there. And young people between the age of 16 and 24 are most distracted generation, but also the most open to mindful interventions. So everybody is looking for ways to become focused. In fact, in my clinical practice, every day several people are coming in with inability to attend to things, inability to focus, inability to sit still, inability to do anything properly and meaningfully. And most of them are walking in saying that, do I have ADHD? And we will go into that in a bit. So this is some more data. About 1 in 5 have emotional and behavioral problems, and that is exponentially rising. And it is going to go more and more, that it is going to go to a crisis point. Close to 70 million people in India suffer from common and severe mental disorders. Worldwide, there are 300 million people. In India alone, there are 70 million people, and that would be a lower estimate. Because a lot of people don't come forward because of stigma of mental illness and being looked down upon. So people suffer quietly. And of course, people go to other centers, alternative therapies, and so on. But they are not diagnosed until their suffering becomes too severe. 1 million people die by suicide each year. So that's the extent of crisis. This is worldwide. 3,000 per day. About 1 person is ending their life every 40 seconds because of lack of understanding of their emotions. And when they leave the emotions in a dormant state, that becomes burnout, that becomes breakdown, that becomes depression, and then leads to suicide. A lot of studies have suggested that those who die by suicide, over 90% of people had severe mental health problems. Severe mental health illnesses, that could have been diagnosed and easily treated, and the life could have been saved if they had sought help properly and consistently. And India is the world suicide capital with over 2.6 lakhs cases of suicide a year. Many people walking into the clinic are now saying, I think I have ADHD, or someone I know have told me that I have ADHD. Why? Because their attention is fragmented, their concentration is all over the place, they are unable to focus, Many people say that not just they're not able to focus on studies, but they can't focus on conversations, they can't focus while they're watching TV. So what is happening? Is ADHD being overdiagnosed? Does everybody have ADHD? In fact, there are some of the people I know, even professionals, psychiatrists, who think that everybody's got ADHD now. And I have argued with people all the time that everybody don't have. A good majority, I think 40 to 50% of people have significant attention problems. And I'll come to the data. So in US alone, the childhood ADHD diagnosis has risen by over 40% in 2003 to 2011. And if you look at adult ADHD diagnosis, so those over the age of 16 who get diagnosis later in life uh, are also on the rise. And some studies have estimated that a 123% increase in the recent years. So significant move. 1 in 4 adults with ADHD who are diagnosed may be inaccurate because of inadequate assessments, inadequate questionnaires, inadequate analysis of childhood problems. Remember, ADHD cannot develop in adult life. They always develop in childhood and they are continuation. So even when we call it adult ADHD, they are continuation of childhood ADHD. Some will be diagnosed and other will be undiagnosed. So people will be diagnosed in later life, for example, in 20s and 30s, when the demands increase, their dysfunction and difficulties increase, and then they start to realize that there's something wrong, and then they seek assessment. Now, those are a very small percentage. Research show that only about 7 to 8% of children with attention problems, hyperactivity, behavioral problems who are assessed for ADHD are diagnosed with ADHD. So a small percentage. Many will have the problem, but very small percentage will have the diagnosis. And about 5% of the adults will have true ADHD. So as I said, 40 to 50% have severe attention problems, but there will be other causes, which could include sleep deprivation, stress, demands, and so on. And in adults, even in India, the studies have suggested that it could be anywhere between 2.5% to 8%, and some studies are suggesting little higher. But Indian data is a very inconsistent. But the US and other European data suggest that about 5%, maybe give and take a few more percent, but not as high as we think that everybody's got ADHD and everybody is seeking attention and assessment. So what is mindfulness? Is there a definition to mindfulness? And can we understand mindfulness? I think many of you already know about mindfulness. It's a practice of being fully present and aware in the moment. And we all say that being present and aware in the moment has been very popularized, especially in the Western media, which we already talked about in the East for generations. So present and aware, and it involves having a non-judgmental attention to thoughts, to our emotions, and to physical sensations of the body. So you can appreciate a thought or be aware of a thought or an emotion. For example, I feel angry, or physical sensations, but you don't judge it. You don't try to discard it. You're just aware of it in that moment. And the practice of mindfulness, of cultivating awareness, is to interrupt an automatic pattern of reactivity. So you don't want to react. People say that I get angry, but I don't know why, because they're not aware. And we know there is enough research to say that if you're aware of your anger, and if you're aware of the causes of your anger, then your anger almost will subside very quickly. So it is to foster or move you from reactivity to a conscious response. In the Eastern tradition, especially in Buddhism, from Theravada and Jain traditions, there is a word called sati, which is mindfulness, which is a part of the Noble Eightfold Path. And Buddha emphasized moment to moment awareness of the body, of the mind, of the surroundings. So you're aware, you're non-reactive, you're non-judgmental, but you just know what is happening around you. In Zen Buddhism, which is mainly devised from Bodhidharma, Buddha's one of the big disciples, he encourages mindfulness through daily activities. So what you do, you need to be mindfully aware. I'm remembered by an example from Buddhist teachings, where they say that somebody attended the place where Buddha was there, and he lived with them for some time. He said, I want to be with you and I want to practice meditation. And he spent a few days, and then he realized that there was nothing happening there. And he then asked Buddha that I'm not quite sure what you guys are doing here. What are you doing at the place? And Buddha would have said that we do what we do mindfully. When we eat, we eat. When we sleep, we sleep. When we have a bath, we have a bath. And when we talk, we talk. When we listen, we listen. So that's what mindfulness in daily activities, awareness and present at all times to foster direct and non-conceptual experiences. Jainism has always thought about mindfulness and of meditation. We call it Samyak Darshan, or the right perception, which involves meditating in such a way so that you're detached. Uh, you're observing your thoughts and emotions without attachment to it. So very similar to Buddhism, where you don't hold on to the thoughts, you observe them, just like you observe the clouds, where they come and go and they're not attached to you. And mindfulness is a key to overcoming karma. So you don't accumulate karma, because if you accumulate your thoughts, your resentments and so on, then you're accumulating the karma. And and when you don't accumulate karma, then you're progressing towards the path of liberation. Hinduism as thought, Shiva is often presented as Adi Yogi, as the first person who taught meditation. And in Hinduism also, mindfulness relates to dhyana or meditation, which is very clearly described in Vedanta, in Raj Yoga by Patanjali, Yoga Sutra, and subsequently popularized. The Raj Yoga was popularized by Swami Vivekananda. Even Bhagavad Gita highlighted mindful actions, which is karma yoga, and non-attachment, especially to your thoughts, your resentments, and your anger and emotions. And the techniques here include pratyahara, which is sensual withdrawal, or atma vichara, so self-inquiry, being aware of your thoughts, but also questioning them, or or, or seeing them. As I said, in Raj Yoga, people always consider yoga as being something which is only involves physical postures. Even like the yoga day, they talk about postures and asanas and so on. But in the eightfold path, what we call as Ashtanga Yoga, there are multiple things that we do. How we treat other yama, how we treat ourselves. Asanas are the postures. Pranayama, the breath control and balance of energy. Pratyahara is turning the senses inwards. Dharana is focusing mind on one point. And then dhyana, which is meditation, which is effortless awareness. So with practice, you're just aware of your thoughts and so on without much effort. So it is Raj Yoga is not just something that you do at a particular time, it is what you do through the day, every day, and every uh, time of your life. And that's what Raj Yoga is, and of which asanas or the Surya Namaskaras are only one part. So mindfulness and spiritual disciplines are aimed at inner clarity, liberation from suffering, and union with true self of reality. And that's what is required in the model setting. We want inner clarity, but we are not even aware of the inner self. We want liberation from suffering, but we are getting more and more entangled in suffering. And we are disconnected from ourselves because of the external distractions and interruptions. Mindfulness in these traditions is not just a mental skill, but a path to self awareness, to non attachment, and to a very ethical way of living. John Kabat-Zinn is a very well known person. He came out with a very good book called Full Catastrophic Living. And he popularized mindfulness in the Western countries, because before John Kabat-Zinn, when they talked about mindfulness or meditation, it was often seen as a religious practice. People didn't want to associate with it, to say we want to keep science separate from religion and spirituality. But John Kabat-Zinn actually trained in mindfulness and meditation, and he gave a simple definition that it's paying attention in a particular way, on purpose, and in the present moment, and non-judgmentally. And he really popularized lot of mindfulness based therapies, and helped to incorporate mindfulness therapies in things like cognitive therapy and so on, which I'll talk about. So there are a few facets of mindfulness, and one of them is observing, noticing sensations, but noticing emotions. So when you're sitting still, you're observing your thoughts and emotions by not reacting to it, but also observing the bodily sensations. And as you progress into the meditative practices, you can shift your attention from the body. For example, often we do the sensations on breath, observations, sometimes observations of body. Then we can move on to observations of thoughts purely. Describe expressing and experiencing inner experience, acting with awareness in a non-automatic fashion. So you become very responsive, you let go of things which are not necessary, and you accept what is in a non-judgmental way. So is there a difference between mindfulness and mindlessness? So mindlessness, you're in autopilot mode, reactive and impulsive. Your mind is scattered, attention is scattered, and your distraction is long-term and chronic. In mindfulness, you're consciously present, responding very thoughtfully. You have a focused attention and a mental clarity. In mindlessness, there is an emotional reactivity, stress and feelings and things that you are amplified. Your relationship becomes shallow because you're not aware of yourself, of your thoughts, of your behavior, for example, what you say, and that affects the relationship. And it leads to a sense of digital disconnect, that you're everywhere else but not here. You're in the virtual world but not in the real world. In mindful person, you're emotionally regulated and you're resilient. And resilient is essentially uh, a person who has faced challenges and developed ability to bounce back. So that's what resilience is. So when we do all the mindfulness therapies, we are working on resilience to make people aware of what they experience, how to respond to it, and how to learn from it. So ability to face challenges and bounce back and learn and grow from it. So that's what resilience is all about. And the core of that is mindfulness training, awareness training. And a mindful person is listening deeply, which is so important aspect of relationships, of authentic connections. And I think it's one of the principle of pillar of the relationship, where you communicate effectively and efficiently because you're listening deeply. And your communication improves, then your other facets of relationship also improves. So mindfulness is a pause. Sorry, I can't see the bottom part. Let me go back. So mindfulness is the pause between stimulus and a response. So why practice mindfulness? Well, John Kabat-Zinn also quite nicely said, you can't stop the waves, but you can learn to surf. So that's a very, very well said quote. It improves emotional regulations. It brings cognitive clarity. It also, the mind and body are well connected all the time, eternally connected, you see. So a healthy mind is a healthy body. So it lowers the blood pressure, it improves the sleep, it boosts immunity. So these are all scientific basis, and it increases empathy, ability to understand the other person's perspective, to be in their shoes. It improves patience and communications. Now, these are the scientific benefits, which is well known through different studies. American Psychological Association has clearly stated that it reduces stress by at least 38%. If you look at Harvard studies, it is showed, where they did structural studies of the brain, it showed that the increase in gray matter density of the part of the brain area is linked to emotional regulation and brain. So it becomes larger as you do meditative practice. University of Washington has suggested that it's improved attention by 30 to 40% if you're doing mindful practices. And regular mindfulness leads to enhanced empathy and relationship satisfaction. It also lowers the cortisol level, which is the stress hormone. So when you're constantly subjected ourselves to stress, to distractions, then our cortisol levels are high. And when the cortisol levels are high, it keeps the blood pressure high, and eventually it damages the arteries, it increases the cholesterol, it damages the heart and kidney and so on. And that causes a wide range of physical health problems. So as I mentioned at the beginning, it's not a luxury anymore. It has become a necessary for survival. Very briefly, there are scientific evidence of meditation. As I mentioned earlier, that meditation was always associated in the West with spirituality and religion, and say that we don't want to talk about it uh, uh, directly. But with MBSR, this mindfulness based stress reduction that we talk about, was devised by John Kabat-Zinn, They did an 8-week study of people who did MBSR and showed that increase in gray matter in hippocampus. Now, hippocampus is responsible of memory and learning, and the size of that actually increased within 8 weeks of meditation. But the amygdala, which is the stress center of a brain, which shows stress response, that reduced in size. So our stress responses, the gray matter was reduced there, and our ability to become more alert and learn better improved. So this is even with 10 to 15 minutes of daily meditation enhances the front of the brain, which is responsible for executive function and control or emotional regulation. So just a small amount of meditation will bring structural changes. We always thought that it just makes people a little calm and you're a little bit nicer, but they're saying that the brain size actually becomes bigger and therefore our functioning gets better. And they look at functional aspect. What about brain activity? Does it change if you meditate? They looked at studies on by Davison and Lutz said that there was when you meditate, there is increase in gamma wave activity. Now, gamma wave is directly linked with attention and flexibility, your ability to think through things and think around things. It reduces the mind wandering and rumination, which is what we call as default mode network. It strengthens that, and it improves the neural patterns, which linked with focus and emotional regulations. The wiring improves in the brain. For years we thought, and many of you will think that we learn for some time and then our brain stops to learn and grow, that all the wires and all the wirings and networks in the brain are already formed and it doesn't change. People always thought that every different part of the body can regrow, but the mind doesn't regrow. But that's wrong. Neuroplasticity suggested that our brain is always growing, knowingly or unknowingly. And how it's growing, it's constantly rewiring as we learn new things, as we do new things, as we meditate, as we relax, as we experience stress, as we experience trauma. It is always forming new patterns and new wires as a way of helping us to cope better and to help the brain to communicate, different parts of the brain to communicate better. So meditation, which is a conscious effort, rewires the brain. And it showed that our brain plasticity improves when we are meditating. It improves the white matter, which is again the anterior cingulate cortex of the brain, and it promotes connections or synaptic strengthening in different parts of the brains or networks, and it facilitates adaptive wiring of stress and clarity. So there's enough evidence to say that mindfulness meditative practices has clear scientific basis on the brain and has clear scientific basis on our mind. And therefore, they're now incorporated into modern therapies. As I mentioned, things like mindfulness-based stress reduction, mindfulness-based cognitive therapy to reduce stress and pain. MBSR was actually devised to reduce stress, to say that if we are consciously aware of our pain, if we meditate, then our pain perception reduces, we are able to manage it better, the necessity for painkillers also reduces. Mindfulness-based cognitive therapy was devised and taken from MBSR, developed in England by Mark Williams, and they looked at preventing depressive relapses. We were doing cognitive therapy with people, but they were becoming unwell again. Even with meditation, even with medicines we were giving them, they were not staying well. And then if we incorporate mindfulness practices into their therapy, then the chances of them becoming ill again reduces significantly. So that's what MBCT was doing. And then we have dialectical behavior therapy, which is essentially for emotional regulations, the kind we see in borderline personality disorder or people with anger management problems, for example, those who are impulsive and reckless. If you teach them to become aware of their emotions, that then has positive impact on their behavior, and that has positive impact on their relationships and how they relate to the world. So DBT is a very important therapy that is commonly used. And then the new one we have is acceptance and commitment therapy. Help people to accept their emotions and then enable them to commit to therapy. So what are the core practices of mindfulness? Well, mindful meditation, simple, sit down, eyes closed or open, focus on the breath, focus on the body, focus on the sounds. So when the mind wanders, gently bring it back. People always say that I can't meditate. I sit down and my mind wanders because our mind is conditioned to wander. We have engaged in distractions, we have engaged in activities over and above that is necessary. For example, the devices in our pocket is constantly feeding us information, bombarding us with ads, giving us access to where we want to be, what we want to do. It has given us a habit of wandering. Mind is wandering everywhere, we can go anywhere. So when you sit down to practice meditation, your mind is still wandering everywhere. You have to gently bring it back, become aware of the thoughts, bring it back. Start with 2 minutes, 5 minutes, maybe 10 minutes daily, and allow for the mind to wander and bring it back. And sometimes the best way to say about meditation is that what is meditation? Meditation is trying to concentrate on the gaps between thoughts. So you're sitting and trying to quieten the mind. You have a thought, and then you have another thought, and you have another thought, and there's no gaps. And over time, the gaps increase. And this gap between thoughts is pure peace. And over time, as you meditate, the gap keeps increasing, and the extent of the peace increases. So even when you do the brain wave studies, a meditative mind or an experienced yogi will have a lot of gamma wave activity. So the mind wave slows down and they experience quietness that you and me don't often experience that. But we have to start slowly and gradually build it up. Just like doing push-ups. If you start doing push-ups, you can do about 2 or 3 initially with difficulty. But as you keep persisting, you can do about 15, 20, and even 100 push-ups. That comes with practice. So keep practicing and keep increasing the duration, because the advantages of meditative practice, even for 10 minutes a day, is enormous, both on your structure of the brain, on the function of the brain, and the quality of your life. The key takeaway from the previous slides are a few minutes of daily meditation reshape your brain structure and function, enhances attention span, improves your emotional regulation, reduces stress, and promotes neuroplasticity. Basically, you're rebuilding your brain as you're living. And that's very important. Rebuilding, rewiring your brain again and again so that you can deal with life difficulties and the grinds better and better. You become more resilient. So what are the core, what are the other practices? So body scan or shavasana. Many of you might have tried that. You lie down or you or sit down, but in shavasana you mainly lie down and you completely relax your body and you start to observe sensations in different parts of the body in a non-judgmental way. And in shavasana, we also constantly move from different parts of the body and trying to relax each part and keeping them relaxed to achieve a complete relaxation with awareness. So remember, you're not trying to sleep there, you're trying to be aware and you're trying to be relaxed. And you're trying to experience to say that what does it feel like? You can do mindful yoga. And often people do asanas, and in the West, you have all kind of steam yoga, this yoga, that yoga. These are all hodgepodge. You need to be mindfully doing it. If you're doing postures, then you need to combine your breath with movement and you're paying attention to the posture, to the part of the body that is being stretched uh, and how it feels in each posture. So you're focusing on the body part and you're focusing on your breath and you're synchronizing the two in a way that you're completely disconnected from everything else and you're completely connected with your thoughts and with your body. That's what a mindful yoga looks like. Don't see yoga as an exercise, see it as an awareness practice. So that needs to be very clear. Grounding practice is basically to bring your mind to the present moment. So sometimes when we are meditating, it becomes quite difficult to sit down, to be still in the body, and to be as quiet in the mind as possible. So that can be difficult sometimes. So you can do simple grounding practice for mindful presence. How do you do that? So there are simple techniques. I mean, if you might remember, your parents or your grandparents would have told you that when you're feeling very restless and anxious, just count backwards. So reverse counting, you do 99, 98, 97, 96, 95, and so on. And you'll notice that when you're counting backwards, Your mind is present. You're no longer worrying about things. If that is too easy, then you do 100 minus 3, which is 97, minus 3, 94, 91, 88. And when you do the practice of counting reverse from 100 minus 3 up to 1, your mind is completely focused on the mathematics and on getting it right. You're no longer worrying. You're no longer anywhere else. You're here, body and mind. Uh, or you can do simple technique like this. This is very commonly used in people with anxiety, people who are subconsciously anxious or unaware of what making them anxious. This is technique to contain anxiety. 5-4-3-2 technique, which notice 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 things you taste. So actually, not just notice, but say it. I can see a phone, a lamp, a pen, a glasses, and a clock. I can feel the shirt, I can feel my hair, I can feel the skin, I can feel the nail, and so on. I can hear 3 things, I can hear the AC. So when you do this, you're taking yourself away from what you're worrying about. Perhaps you know what you're worrying about, perhaps you don't know, but you're moving away from that to this technique. Or you can do box breathing, where you inhale to the count of 4 seconds, hold to the count of 4 seconds, exhale to the count of 4 seconds, and hold to the count of 4 seconds. Inhale, hold, exhale, hold. Box breathing. When you regulate your breathing, you become calmer, you become less stressed, your anxiety resolves. When you regulate your breath, your anxiety comes down, your stress comes down, and you become more aware of quite what is it that you're worried about, so that you can shift from worry to action when you are calmer. But before you can get into action of solving what you're worried about, you need to be aware of it. And that's what we train people about. The Vietnamese Buddhist monk called Thich Nhat Hanh, who died a few years ago, very influential Buddhist monk, he talked about mindful walking. And in his retreat, he often used to take people on a mindful walk where you focus on steps, on your breath, and on your surrounding. And you consciously keep your mind on that. You're looking at your steps, you're looking at your breath, and so on. And that most people are not able to do. If you go to the parks now, people are indulged in mindless walking. They're playing music, they're looking at the phone. All of them are looking at the phone. When you go to the park tomorrow, have a look around. Everybody's sitting on a bench looking at the phones. They're walking with the phones. They're walking and chatting on the phone and so on. That is completely mindless living. Not just mindless walking, but mindless living. You hold an object and notice it. That's what is happening. We're not able to know what we are holding on to. We are not able to taste what we are eating. We're watching television and don't even know what the food feels like in our mouth, what it tastes like in our mouth, and so on. What I was saying earlier, mindful eating, eat slowly, chew thoroughly, notice the flavors and texture, hunger and fullness. Never sit in front of the television and eat. Ideally, never sit in and watch on YouTube and so on. When I was young, my grandfather often used to say that he was very, very strict. We were not allowed to talk at all. Because when you don't talk, when you indulge in mindful eating, then one, you know the flavor and texture of the food, you know when the hunger is over, you know when the fullness is achieved, and you stop. You don't mindlessly eat. You eat what is required. So when you're full, you stop. That's what mindless eating is all about. No distractions, just full awareness. And that is meditation. If you can't meditate when you're sitting down, that's okay. Eat mindfully, walk mindfully, each step aware of your breath. No distractions. Never take your phone with you. It's very important. If you can't spend a few minutes with yourself, with your thoughts, with the nature, then what will you be able to do? Mindful use of tech, we have to tell people technology is here to stay. It's not going anywhere. But we need to pause from opening apps. We need to be aware of the impulses. Why am I reaching out to my phone again and again? Why can't I just put it away? Why can't I put away the phone so that if it's out of sight, it's going to be out of mind? See the intentions before engaging. Is it necessary to check the messages again and again? And so on. And it has become such a second nature habit that we are not able to stop ourselves. And then the parents come and complain that the children are not able to stop the phone. And the young are complaining about the old are complaining about the young. And with everyday chores, when you're washing the dishes, ironing the clothes, notice the sensations, notice what you're doing. Do the job properly so that becomes meditation of daily activities. Sometimes people find it easier to journal, to write down your thoughts, commit pen to paper, write down how you feel, what made you feel the way it made you feel. Why am I feeling this right now? What happened? Put it down on paper so that your thoughts might appear and disappear and you might not even know. But when you put it on paper, it is there for you to see forever. So that's what journal is all about. To to write down, to process your thoughts, to understand them, and to visibly observe them. It gives you a better ability to reflect on what was happening, why you were feeling the way you're feeling. It also helps you to learn from your thought processes. We know all the creative flows like art and music and dancing, uh, which brings you into presence, not to the perfection. And people often find the flow that a dancer, when he's dancing in a very meditative practices, he and the dance is no longer separate, they're one. That's what it's called as flow. A musician, when he's playing the music, he and the musical instrument is one. And that's where he's in a state of flow, completely meditative, completely cut off, just doing what he's doing, and so on. Connect with the nature. We have green spaces around. Fortunately, at least some is left. But listen to the sounds. Keep the phones away. Observe non-judgmentally. Don't have to comment that this is just lovely. Just observe it. Feel it. This is form of a nature meditation. So just a few more slides. So mindfulness in a noisy world, there are 5 truths to remember. Mindfulness is a modern default, and we are stuck in an autopilot. We're constantly reacting, rarely reflecting, rarely aware of where our mind is wandering and where it started. Remember the time you were reading a book, you read a whole page, maybe 2 pages, and didn't even know what you read, and then you have to go back and see it. Sometimes you're watching a movie and you've missed a single major chunk of the movie, not knowing what was happening. Many people say that I left work and I reached home and I don't quite know how I reached. My mind was completely lost and I was driving with an autopilot. No, it just does. The muscle memory. Mindfulness isn't a luxury. Mind, it's an essential for emotional clarity and focus. Remember, all your distractions, all the things that you're engaging in is feeding distress. The digital overload and the speed at which we are bombarded with information is fueling our fragmented mind, our fragmented thought processes. It's fueling anxiety and burnout. Now, awareness has to be a turning point. We have to start to give attention to it. And the shift begins by noticing simple things in life that you do, uh, by pausing, slowing down, and creating a space for that awareness of quite what you are doing, quite what is happening. Starts with small steps, and you can see a big shift. Be very, very consistent, just a few mindful moments daily, and increasing those moments day by day can transform your mental state from being mindless to mindful, from being unhealthy to being very healthy and happy person. Uh, I'm just going to skim through that. Uh, the second one is why. Fight with yourself. Why fight with external foes? He who conquers himself through himself will obtain happiness, said Lord Mahavir. And when mind is still, the heart speaks, says Vivekanand. And Paramahamsa Yoganand said it nicely as well. Stillness is the altar of spirit. And Rumi said, look past your thoughts so that you may drink the pure nectar of this moment. And Buddha has always said it well. Do not dwell in the past. Do not dream of the future. Concentrate the mind on the present moment. And he said it very nicely as well. Mind is everything. And what you think, you become. So in conclusion, mindfulness, essential for connection and clarity, is not an escape. People always say that meditation is very selfish. It's not an escape. It's deep engagement. Start small, breathe, pause, observe, maybe a few minutes every day, and it will bring about significant changes. Thank you for listening. And I hope it was helpful, and we will take as many questions as necessary. I hope you can connect with me. I do a lot of writing, short videos on mind sense on YouTube, to give daily tips, to give daily motivation, to give daily engagements, so that people can take at least some points every day and bring about those necessary changes in their life. We need to shift from being mindless in everything we do, whether it's our relationships, our interactions, our activities, our behavior, our pursuits and desires in life. From mindless to mindful is what we need to do, and that is the need of the hour and ahead of our times.
Thank you. Thank you, Dr. Roshan. That was very insightful and gave us a lot of things to think about and contemplate and apply in our own lives. Couple of questions we can surely take. Number one is, in what ways is mindfulness different from Vipassana meditation? And as a follow-up to that, there's another question. Many psychiatrists advise against meditation for persons with mental illness. How valid is this?
Vipassana meditation is just part of Buddhist practices. And for those who have done Vipassana meditation, they take it to the extreme of not even having conversations, of not talking. And that is enabling or even initially forcing people to have a complete awareness of everything they do. In people who done Vipassana will know that they're not even supposed to have hand gestures when they're having conversations. You are just with yourself, with your thoughts. And mindfulness is awareness. So meditation is a way of cultivating that awareness. So it's the same, it's not different at all. And with the second part, it becomes difficult for those with severe mental illness like schizophrenia, bipolar disorder, especially when they are in an unwell state, for them to become aware of the thoughts. Because for schizophrenia, for example, the person is living in two worlds, one that is outside of them and one that is inside of them. So for example, with you and me, we can see what's happening around us, we can hear what's happening around us. We are consciously aware that I am different from the outside. For person with schizophrenia, they have an internal processes going on and external processes. So for them, it is very difficult they're trying to, for example, with paranoia, they're struggling to get away from those paranoid and fearful beliefs. So for them to become more aware of it becomes hard. So when they are in a decompensated state in severe mental illness, then meditation is not just not advisable, but they cannot be practiced, because the person is too unwell to sit still or take note of the mind processes. But in all the other mental health issues, mindful practices will help people. For example, when we do therapy, we are with our education and advisory, we are making them aware of their problems. But they can also practice and become more aware of their emotions, to say that predominantly what kind of emotions do I have and how do I bring about changes in that. Often when we are in a distressed state, we want the other to change, the outside world to change. We don't want to work on our mind and to say that, what if I see things differently? Can I change the way I look at things? Say, for example, in stress management, we always say that stress is never outside. It is always inside you. It's how you react to people, how you react to things.
Jai Shri Krishna, doctor. Can I speak?
Yes.
Yes, please.
Can you recommended Vipassana for the patient of epilepsy or have some psycho problems, like simple problems, but they have a medicine?
I think Vipassana meditation, actually in Bangalore also, they require a clearance certificate for people to attend Vipassana center, because it's a very difficult practice. If people have psychosis, it's certainly not advisable. And many people who have gone to Vipassana centers have left very soon because they could not tolerate and they felt more decompensated. So not
So
advisable.
you are not recommended strictly. My brother want to go and मैंने भी किया है Vipassana.
विपासना मत करो, सिंपल मेडिटेशन करो, रोज
Okay,
करो.
तो उसको he is a yoga teacher.
डेली प्रैक्टिस
बट
करो.
उसको इपिलिप्सी भी है और थोड़ा सा मेंटल प्रॉब्लम भी मतलब कभी कभी इपिलिप्सी की वजह से उसे 10-15 साल में ट्रिगर होता है।
So I can't give specific advice, but if his mental health is been quite stable and he is able to meditate at home for prolonged periods, then he should venture into going for the next level. It's a bit like saying that I can't walk at all, but I want to do a trekking of 20 kilometers on the mountain. So
Hmm.
you
So
have
could
to
I
have certain
could I
level of
just
fitness to be able to go to the next level.
तो जा सकते हैं, ऐसा कुछ नहीं कि नहीं जाना चाहिए।
Depends on how he is, and if they're asking for a certificate of clearance, then he could see somebody to get an advice, get an assessment, and then get a clearance.
no, well said, doctor. Uh, in our self-help support groups, we sometimes get the question that my body is fatigued. And how can that state of mind, how can I actually talk about mindfulness and meditation?
So in stress, the mind is wandering. So when the person is experiencing stress, for example, you get mental exhaustion and physical exhaustion.
Right.
So mentally, when you're exhausted, you're no longer attentive, you don't enjoy things, you don't want to do things, you just want to lie down, you don't want to talk to people. You're physically exhausted, you don't want to do activities, you don't want to go to the gym, you don't want to go for a walk, and so on. So if you're physically fatigued, then it's very likely that there is a mental component to it as well. So mind and body are always interconnected. They're not separate. So when you're stressed, you get gastric disturbances, and when you get gastric disturbances, you get stressed and anxious. So they are both interconnected. So if you're fatigued, perhaps, for example, when people are fatigued, when they sleep and wake up, they are refreshed. Why? Because they are less tired mentally, and therefore they're physically rested. So a good night's sleep will give you mental clarity and physical relaxation. It rejuvenates us, no? So sleep is a prolonged period of rejuvenation. If you can achieve a good sleep, and meditation is a shorter period of rejuvenation.
I have another question from a participant. Can I just finish with this?
Yeah.
Can a patient with anxiety and hypertension do guided meditation but find it difficult to do on their own? In that case, what would be the best technique to support them with their emotional regulation? I think it's particularly about guided meditation as opposed to doing it on your own. I think that.
So guided meditation is exactly the same as meditation that you're doing on your own. Like for example, when you do shavasana, it is guided. If you do it in a group, then the teacher is asking you to focus on different parts of the body and move gradually upwards from your toes to calf muscles to side. That is guided. So somebody is guiding
That
you.
is Yoga Nidra.
In the other YouTube guided meditation, for example, somebody is guiding you to a more relaxing, nicer place than you are. They're making you imagine that you are in front of a beach, the breeze is hitting your face, you're feeling much calmer, you're no longer tensed, your body is relaxed, your eyebrows is no longer frowning, and so on. So if the guided meditation again would be a start of doing meditative practices without guidance. So it will be the initial step. I can't do quiet meditation, therefore I do guided meditation.
Okay. We have a question about Yoga Nidra.
Sir,
Yeah.
I just want to ask, at morning time, I feel somehow anxious and depressed, feeling depressive symptoms. So how to cope these symptoms with mindfulness, or what to do?
Just all the things I told in the talk earlier. Start small, bit more relaxing techniques, no phones in the morning, do some exercise, do some yoga, do meditation as much as you can. You can do 5 minutes, 10 minutes, 15 minutes, but be very consistent. If somebody is feeling very anxious and depressed in the mornings, then that is usually a sign that they are not in a good physical or mental health. In clinical practice, we see that people who are more anxious and depressed in the evenings, it is usually environmental causes. For example, work is stressful, hours are very long, and so on. But after resting in the night, if you wake up in the morning feeling still anxious, then these are all again signs that where you need to seek professional help and do more than what other people would do, to relax, to exercise, do simple things in a more efficient, effective manner. So that
What to do against overthinking?
that is again, overthinking is again is a habit that your mind is wandering everywhere without actually knowing. You can journal, you can write down what you overthink about, and then try to work on each of those worries. So I worry about 10 things, I overthink about it, but I'm not doing anything about it. So it's like being in a rocking chair and not reaching anywhere.
Okay.
So
And
if
a
you're
person,
overthinking,
sorry,
then write it down and process the overthinking. What do you overthink about? 1, 2, 3, 4, 5 topics, and then say, okay, let's take up topic number 1, which I overthink and worry about, and then let's work on that. Let's see what I can make differences to that. Then work on 2 and 3 and 4, and maybe you need to work on 2, 3 together. So worry to action. That's how the overthinking can be.
There's another question
working.
regarding memory. How this is a good question. He says how I think it relates to your listing, your to-do listing kind of thing. Which he says, I don't really have a question regarding mindfulness, but rather one regarding memory.
Mm.
Could you tell me how to improve my working memory? What I mean is, how do I improve my ability to remember the things that I have read or heard?
I, read very attentively, listen very attentively, because memory, what is memory? Memory is a byproduct of attention. So when we are attentive, then we register information. When we register information, then we are able to recall the information. And recalling information is basically memory. Information which is registered and recalled. But if you're not attentive, then you haven't registered, therefore you can't recall. So for example, if you watch a good movie and you enjoyed it and you watched it properly, then you remember the story properly. But if you were talking to somebody on the phone and also watching a movie, then you neither saw the movie properly nor do you remember it properly. So do one thing at a time. If you're reading, then do nothing else. If you're watching movie, then do nothing else.
This brings us.
It is how it is. One thing at a time.
I want to ask something कि पेन होता है और गुस्सा आता है और बेड पे ही पड़े रहने की इच्छा होती है because of overthinking और सब पे गुस्सा आता है तो क्या करें? मैं तो पूरे दिन सोती रहती हूँ।
कंसल्टेशन करना पड़ेगा। ये ऑनलाइन पे तो उसके बारे में बात हो नहीं पाएगी।
बट सोने से मैं रिकवर हो जाती हूँ दिन भर सोने रहने से।
दिन भर सोने की जरूरत नहीं है।
आप प्रोफेशनल हेल्प ले लीजिएगा जी, whenever you can, wherever you are, whoever is closest and whoever is.
Because दिन में सोने की जरूरत नहीं है। आप रात को सोइए, sleep in the night and force yourself not to sleep in the day unless you're doing hard labor. आप 4 बजे उठ के हार्ड लेबर कर रहे हैं तो आप दिन में 1-1.5 घंटा सो
हो रही है, गुस्सा आ रहा है सबके ऊपर और जिससे बॉडी पेन हो रही है अंदर के अंदर, कुछ करने एकदम थकान महसूस हो रही है। दैट इज अ सिम्पटम्स ऑफ ओवर स्ट्रेस ना।
आप गुस्से के बारे में लिखो कि क्यों गुस्सा आता है और उसमें देखो कि क्या कर सकते हैं। क्योंकि किसी और पे गुस्सा आता है तो उसको बदल नहीं सकते, अपने को ही बदलना पड़ता है ना। एक पेशेंट मेरे पास आया और मुझे बोला कि आई एम एंग्री विद एवरीबॉडी। तो मैंने बोला हु आर यू एंग्री विद? बोलता है आई एम एंग्री विद एवरीबॉडी। तो आई सेड व्हाई डोंट यू गो होम एंड सेंड एवरीबॉडी? बोलता व्हाई? बोलता है कि आई विल मेक श्योर दैट दे बिहेव प्रॉपर्ली, विल ट्रीट एवरीबॉडी, यू बी एज यू आर। वैसे हो नहीं सकता ना। व्हाट आई एम ट्राइंग टू से इज दैट our anger is our emotion and we react to something that is not to our liking. Then we need to say, okay, do I need to change my thinking or can I change the other person? And often we need to change our own thinking.
Last question before we wind up, doctor.
Yeah.
How to overcome the indecisiveness, which is a byproduct of overthinking. How to overcome the indecisiveness?
Same thing you do. You can write down.
If you
write down your decisions,
then it's difficult to do even mindful. The same applies to social care.
So you write down things that you need to decide on and look at the pros and cons for the decision. For example, I want to do this and I don't want to do this. So what are the advantages of doing something and what are the disadvantages of doing something? And
This,
likewise, in the back, you write pros and cons, likh lo. Or,
right.
and then you can see it and decide for yourself that something needs to be done or not need to be done.
Thank you, doctor. Thank you so much.
Ganesh, just one question. Can
yes.
people with bipolar problem do Sudarshan Kriya?
Sudarshan Kriya mein generally if you get a lot of anxiety attacks, then avoid it because Sudarshan Kriya is encouraging people to do rapid breathing. Even Kapalbhati and rapid breathing mein, it can trigger panic attacks. So उसमें you do deep slow breathing technique, not fast breathing का जो क्रिया होता है वो मत करें.
अच्छा, thank you so much.
You do slow breathing kriya. Deep slow breathing करे, ओमकार नमना करे, अनुलोम विलोम करे, slow breathing करे. Because slow breathing will regulate your emotions and reduce your anxiety better than fast breathing. तो fast breathing भी अच्छी होती है, लेकिन सबके लिए नहीं.
One last question, sir.
Yes,
Hello.
go on.
Sir, daily practice of mindfulness can reverse the mental illness, means anxiety or depression.
बिल्कुल, बिल्कुल. And we already touched upon that earlier to say it changes the structure of your brain, it reduces anxiety, it improves your functioning and so on. So रोज करके देखें आप. Why don't you do it every day for the as much as possible for 5-10 minutes, and then you can tell Ganesh and you can message us to say how you're feeling after a month.
Okay. Thank you.
But consistency is the key. But consistency हमसे हो नहीं पाती. And one of the things I often tell people is that everything which is unhelpful, we do it very consistently. Everything which is helpful, we do it inconsistently. जो भी अच्छा है वो हम बराबर से नहीं करते और जो भी फालतू है उसको हम बहुत ज्यादा अच्छे से करते हैं. तो उसको उल्टा करो. आप अच्छी चीजें जैसे किताब पढ़नी है रोज, मेडिटेशन करना है तो रोज करो, किसी भी हालत में करो. और जो चीजें बेकार की है उसको मत करो, उसको कम करो. उसमें इनकंसिस्टेंट हो जाओ. बोलते हैं ना कि दवा लेनी है तो बराबर से लो और बाकी जो शराब पीते हैं वो उसमें इनकंसिस्टेंट हो जाओ, उसमें कंसिस्टेंट मत रहो.
जी.
Okay.
Doctor, thank you so much for practical insights into mindfulness. I mean, it clearly says it's not just knowing, but practicing. And I think that's a very important difference between just internalizing as knowledge and practicing as a skill. And I think your idea of starting small is very, very valid. I mean, we sometimes hesitate to take the first step. Let's take the first small baby steps till we take the next steps towards bettering our mental health and peace.
Yes.
Thank you so much, everyone, for being here. Join us on the first Wednesday of the next month for the next speaker. Thank you, Dr. Roshan, for being with us and enlightening us. Thank you very, very much. Really appreciate it. Thank you so much. Thank you.
Thank you so much. Have a good one.
Thank you so much.
One serious question.
Thank you so much.
Hello.